Public and private community gatherings as defined below are prohibited anywhere in Dallas County. And that is essentially, I'll read that so there's no misunderstanding in full. Second, restaurants with or without drive-in or drive-through service and microbreweries, microdistilleries, or wineries may only provide takeout, delivery, or drive-through service as allowed by law. Bars, lounges, taverns, or arcades and private clubs shall close. In addition, the Office of the Dallas County Judge and the Dallas County Health and Human Services Department strongly urge organizations that serve high-risk populations to cancel all gatherings until further notice. These recommendations are based on the social distancing practices attached to the order, as well as the implementation of mitigation strategies for communities with local COVID transmission. For purposes of this order, a community gathering is any indoor or outdoor event or convening subject to the exceptions and clarifications below that brings together or is likely to bring together 50 or more persons at the same time in a single room or other single confined or enclosed space, such as an auditorium, theater, stadium, indoor or outdoor, arena or event center, gym, meeting hall, conference center, large cafeteria, or any other confined indoor or outdoor space. An outdoor community gathering under this order is limited to events in confined outdoor spaces, which means an outdoor space that is enclosed by a fence, physical barrier, or other structure, and where people are present and are within 6 feet of one another for extended periods. So let me stop for a second and say that does not mean you can't go outside and take a walk or go to the park. For purposes of clarity of community gathering, that does not include the following so long as visitors are generally not within 6 feet of one another for extended periods of time. Bus terminals, airports, office space, schools, residential buildings, grocery stores, shopping malls, or other retail establishments, not including restaurants with or without drive-in or drive-through service, microbreweries, microdistilleries or wineries, bars, lounges, or taverns and private clubs, where large numbers of people are present, but it is unusual for them to be within 6 feet of one another for extended periods, and hospitals and medical facilities. In all such settings, the Office of the Dallas County Judge and the Health Authority recommends following social distancing recommendations and personal hygiene measures such as hand sanitizer and tissues should be provided whenever possible. If someone in a household has tested positive for coronavirus, the household is ordered to isolate at home. Members of the household cannot go to work, school, or any other community function. Nursing homes, retirement centers, and long-term care facilities are instructed to prohibit non-essential visitors from assessing their facilities unless to provide critical assistance or end-of-life visitation. Public and private school and institutions of higher education are instructed to provide a safety plan to the Dallas County Office of Homeland Security and Emergency Management before students return to classroom settings. And that is to be done at least 72 hours before students are to return to a classroom setting. Additionally, the Office of the Dallas County Judge and the Health Authority instructs all employees to remain at home let me say this part is not an order, but I'm strongly encouraging you, if you're sick, stay home. Employees for private businesses and nonprofits with 6 or more employees in the city of Dallas can use their paid sick leave when they are sick or to care for sick family members pursuant to a law that was passed last year, and I just remind people of that. This order will be posted conspicuously, and you will get a copy. And I would ask staff, because I don't see the time for the schools on here, to amend that or to show on the order that the press gets the 72 hours that people before school is back, the one that you give them. with that, I've got a couple of things I want to say, and I'm going to turn it over to Phil. I know these are uncertain times for our community, but there is some good news, all right? Today, we opened drive-through testing for first responders, health workers, and Parkland patients at a facility at Parkland. And in the coming days, we will open 2 large testing facilities, one in Grand Prairie at the former Verizon Theater, and one at the American Airlines Center in a parking garage that will allow for drive-through. We will get more information on that in the coming days, and there'll be an announcement about that. But I think it's important that you know good things are happening too. With those 2 new facilities that will open, those will be a joint operation with the county and the city and the federal partners, and that will be led by our county hospital, Parkland Hospital, along with Dr. Phil Huang. And so that will allow us to test up to 5,000 people a week when we get those open, and the feds send down the equipment for that. So that's good news. Another piece of good news that I want to remind people is our first 2 patients went home well. Okay, getting the coronavirus is a bad thing, but it's not necessarily lead to long-term impairment or death in every person. The fact that it has a higher than the flu by a long shot mortality rate in many populations, and the fact that it spreads so easily has us working to keep that from happening in our community. But most people who get this disease will recover from it. So we had 5 cases today. One of those cases is our second confirmed case of community spread. Community spread means that there's no travel explanation of them getting it somewhere else. There are many things that have happened over the last 48 hours that have led to changes and tightening of restrictions, and I want to remind people who watched President Trump's press conference of what my friend Dr. Anthony Fauci said. Dr. Fauci said that if you are looking at the data for today, you're always 5 days behind. So what we're trying to do here, I just want y'all to understand this, we're trying to be like Lodi, Italy, that was aggressive on the front end, and that as a result, hundreds of if not thousands less cases than the town down the road that waited for over a week to act. And that's what we're trying to do, is get ahead of this. But there's a challenge that we have, and so I want to speak about that challenge. The reason for the bars closing, if you look at what the White House put out today, what President Trump said, and this is a direct quote from what President Trump's release said, in states with evidence of community transmission, which we have, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed. This is in a message to governors of those states. Here's our challenge, and I've talked to the state privately about this. I'm going to talk to the public about it now. If Dallas County acts aggressively, but people have cars and we all live, there's 2.7 million people in Dallas County. There's 7.6 million people in the Metroplex. If all this accomplishes is that the bars in Dallas County close, and there's 3 times as many people in the bars in the surrounding counties, and then all those people get on our roads to take a longer drive home, we haven't done much to keep our community safe. We've done all that we can, and this government will do all that we can to keep you safe. But we need our governor and our regional partners to come together, and we need to. The only way really to do that is through the state. We need the state to come in and lay out some parameters on that, and I hope that they will. It's important also to remember why Dallas, there's two big reasons why Dallas County is different from the surrounding counties, but we all are in this together. So even though there's not community spread in our other big counties, and even though there may not be a case yet in some of our smaller counties in the Metroplex, we're all in this together. But the fact that we have community spread in not one but two places here in Dallas County that's just been documented on the small amount of testing capability that we've had, which is more than the rest of the state, but relatively small to the 5,000 a week we're about to have, tells you that we have community spread and we have to act. But we need our neighbors alongside us, and so we need the governor to lead on that. And I appreciate the great work he's doing, but for these prohibitions to work, they can't be where somebody can drive a half a mile and congregate in large groups. Second, I want to remind you about this about Dallas County. In Dallas County, our population looks different on a health basis than some of the surrounding counties. And if we're one of I think 13 states that are left that have not taken Medicaid expansion, which is what would provide insurance coverage to people who cannot afford, who work but cannot afford insurance. That would insure or provide coverage for 250,000 people here in Dallas County. That means 250,000 of the people that this could spread to don't have access to a primary care physician. That makes our job here much, much harder, and it makes us behind 37 states that have that. And so we must act aggressively to be able to have a chance to stem the tide of this. Let's see. Finally, before I turn it over to Phil, I want to remind everybody that government can only do so much, particularly in a situation like this, because really it gets down to personal responsibility. There's no way that I can legislate or anyone can legislate for you personal responsibility and looking out for not just yourself but the community. But did you notice today from the National Institute of Health, they didn't say 50, they said 10. They said avoid groups of 10 or more in a social gathering. We need people to not just look at what we're doing in these orders, but look at these guidelines and follow these guidelines. You know, what we've got to do as a community is we've got to turn our fear in this community to faith. Faith in a higher power, but also faith in the science. These guidelines are the science. You need to have faith in those guidelines and you need to follow that. Secondarily, we've got to turn from selfishness to sacrifice, all right? And by that what I mean is you may feel like it's all right for you to get together with your friends, but the life that you save may be your Nana's or your friend's Nana if you will just stay at home for a time. We just need to stay at home for a time. We need to hunker down and we need to get through this. We've got to move away from panic. People do not make good decisions when they're panicked. We got to move to prayer and personal responsibility. And I know you can do this, North Texas, because every time a challenge hits North Texas, they rise above that challenge, and together they defeat that challenge. But we're all in this together, and we cannot do it as government, and we cannot do it as first responders and the health community. The health system will be completely overrun if you do not act with personal responsibility.